good morning everybody. Or is it afternoon, hopefully? No, not quite. So I'm here to talk about shaping relational expertise across communities and territories in South West London, and this is an evaluation of joint faculty development for our Train the Trainer programme, and this is in collaboration with St George's and Kingston as well as Croydon. So the aim was to examine the impacts of co-planning and co-delivering series of clinical simulation Train the Trainer programmes on faculty development across 3 trusts. So our 3 trusts in South West London, we were funded by HEE to deliver a series of 5 2-day clinical simulation Train the Trainer courses across our respective sites over a 6-month period between January and July 2019. Teachers in the programme resources were shared and adapted at each local context, and the programmes co-managed and co-delivered at each hospital site. We aim to examine the impact of the process of planning and delivering the Train the Trainer programme on our shared faculty working across the 3 trusts to generate and identify explanatory theory for our faculty development from these impacts. Those are lovely settings, so St George's, Croydon and Kingston are the best photos I could find of each trust. Our course description. So we covered the theory and design and delivering of simulation-based training, including a mix of patient simulators and actors. The approach was to give all participants a hands-on experience in small groups with experience and rich opportunities for personalised feedback. It would increase the opportunities to hone their teaching skills, and using simulation combined with observing the teaching approach and giving constructive feedback to consolidate their learning. So the methods that we used, we had 57 NHS staff involved in teaching, design and setup with simulation-based learning, 45 clinical teachers attending 5 Train the Trainer courses, with 12 members from the 3 inter-simulation units, and these remained consistent throughout the 10 sessions, or the 5 sessions, 2-day sessions that were run. We collected our data to explore and understand those impacts from course documentation, 60-minute focus group, post-course survey and a follow-up survey. Looking at the relational agency and relational expertise, a concept first described by Edwards 2005 as a result of research into the development of successful interagency collaborations. For us, we thought this was particularly useful because the literature on this interprofessional partnerships is replete with the descriptions of the struggles of interprofessional workings to be effective. There's not many trusts, I believe, within the South West network who collaborate in the way that we have, and it's very, very unique, and it was very, very effective, more effective than we thought. So to apply our concept of the relational agency for trainers and participants, we also collect data from course questionnaires, focus group interviews, and we put this into our, if we look at our relational agency, we had a lot of meetings prior. This was planned over a year before we actually delivered our courses. We looked at the observations and practices of each site, of each setting, and we looked at the layout, the equipment, and what resources we had at each trust. Over those 10 days, we co-delivered those courses, making sure that they were exactly the same and run perfectly to within each trust limit. We also met formally at South London Simulation Network meetings, where we also meet with other simulation centres across South West London. We looked at bid submissions and funding, which is where we originally got the funding from HEE, and we shared our educational documentation so that we were all on the same page. So looking at our faculty development for us, the trainers, we were looking at informal and formal and individual and group. So on an formal level, we observed teaching and peer student evaluations across all 3 sites, and formally as a group, we delivered the course together, and we looked at our work-based learnings from our South London Simulation Network meetings. On an individual and very informal basis, we all went to all 3 sites, so each of us visited each site, and this was done over a couple of months, where we would look at exactly what we had, and then we would adapt our courses to each site. So there was very, very different layouts with each simulation centre, so the course had to be adapted so that we could deliver exactly the same training. And then as a group, we had our inter-hospital network course briefings, and they would happen either via the telephone, via a very poor WhatsApp group, emails, and obviously face-to-face. And this developed our network expertise. So belonging to a multidisciplinary network, we looked at our enhanced collective practice and how we run our training at each individual site. We understood the workings of other SIM centres, and this was a really, really big benefit for us, because what we were able to take away from each individual centre was some really, really good things, and things that we don't necessarily do at our own site that we've now implemented, and vice versa. We develop a common focus. We all want to deliver the same training, and our focus was to ensure that we had a faculty bank that we were able to share collectively between 3 trusts. We build a shared language, so again, educational documentation, all of our PowerPoints, all of our pre-briefing, debriefing were structured in exactly the same way. And we looked at constructive alignment, so this wasn't just a one-off, this was a long, thought-out process to finally deliver. And we looked at conceptualizing our expertise in relation to other centres as well. So this was just a little bit, a couple of phases. So we had our ideas belonging to a network, and we collected the data. So we had an interview where we recorded as we sort of talked about all these different phases. And there was just a couple of things that I thought was quite good. So we had a mix of sim managers, educationalists, teachers, and simulation technicians, as well as simulation fellows. So we had a really nice group of very, very different experiences. One of our simulation technicians is an ODP by background. Another one of our sim technicians is theatre by background, and another one of our technicians is film and television. So they brought a lot of technical ability that we wouldn't necessarily have within healthcare. You've got sim managers, you've got who's paramedic by background, sim manager and teacher who's nurse by background, and an educationalist. So we had such a lovely mix of people to bring all those experiences. And I think it's a massive achievement. Not only that, the 3 trusts become very, very close with our workings as well. And it was a really, really good peer review for one of our for our teachers. And our simulation technicians got to have their own network and sort of get together and learn from each other's experiences in those different areas. So as our theatre and our television technicians weren't very, very medical or clinical, we had our ODP technician who was able to bring that side of it in. So when we're looking at our development of our participants, again, formally and informally, and individually in group, we made sure that obviously our trainer courses, they participated, they had small group teaching skills, and then we gave them personalised feedback as individuals. And we also did structured team teaching, expert feedback mentoring, and team scenario design. So we allowed the groups to design their own scenarios. We also looked at the inter-hospital recruitment as facilitators and faculty networking with local and inter-hospital faculty. So they would be able to go and teach at any course at any of the 3 trusts. So we've got a couple of follow-up from our findings and from our follow-up survey. So we asked, did the course have a positive impact on how you teach? And 80% said very, very much so. A couple quite a bit, and 1 person with some. Also, as a result of the course, we looked at these answer choices and how effective our Train the Trainer course was. So we looked at 60% of our participants, which was 25 out of 45 who responded to our follow-up survey, said integrated simulation activities into existing training in their areas, which means that they then took our Train the Trainer course, took it into their own departments, and they would then implement that within their in-situ simulation training and as their groups. 32% were talking about networking with other teachers and co-designing, co-delivering their training. This is quite apparent, especially within Croydon, and I'm sure that my colleagues from Kingston and Georges will say the same. There was a lot of people who would go to different departments and then they would gather up. So we had maternity and paediatrics who worked together to design a large-scale scenario that maybe they wouldn't have had they not attended the Train the Trainer course and met each other through that. We also looked at 56% participating as a teacher on hospital or postgrad simulation training days. And this was particularly interesting because out of the whole faculty bank that we have trained, There's not been many that have facilitated at Croydon, but they definitely have facilitated at the other 2 hospitals. So I'm a little bit upset that they haven't come and trained at Croydon, but it all depends on availability and things like that. We asked how often have you integrated these components into your teaching since the course. So we looked at patient simulators, so that would be our high fidelity mannequins, our part task simulators and our hybrid simulators, which may be a patient simulator and an actor. And if we have a look at this, quite a lot would use the patient simulators over and above the others. But interestingly enough, on the same question, we also asked regarding role play, mental simulation and observer roles, and we found that they actually use our pre-briefing and that mental simulation to sit down as a group and discuss a scenario, or the teaching session prior was so much more effective, which is what we aim to teach in our trainer course. And nearly 50% of our follow-up survey candidates said that. We also looked at their role play, so they'll do a lot more role play than what they did. So we found this quite interesting because we thought they would want to be using the high fidelity and hybrid simulators a lot more, but we're really, really pleased that they ended up using more of the mental simulation, which is what we aim to teach. So our results hold implications for practice and research. It's a longitudinal programme and it provided opportunities to build trust and relationships amongst participants across all 3 hospitals. We achieved this through both harnessing the existing and development of new informal learning networks throughout the planning and delivery phases. And this was linked to a greater sense of motivation and enthusiasm. Also, our local regional networks such as the South London Simulation Network and shared funding from HEE created a space between us often competing organisations to reflect on our practice and actually collaborate more closely rather than competing. So in conclusion, professional work and co-delivery of Train the Trainer was knowledge work. It wasn't just a simple transfer of knowledge from one trust to another. We worked relationally, and it was the key to building our common knowledge to jointly interpret and respond to local needs, i.e. knowledge is a transactional thing, it involves recognising the histories of each trust and the practices to jointly produce a vision of future practice. And our networking builds teacher and programme resilience and supports sustainability. And the longitudinal depth of contacts and teaching opportunities provided the glue for teacher practice and organisational developments captured in our data. Thank you very much for your time.